Thank you to everyone. Good afternoon. Can you see my slides now? Yes, it's working?
Yes.
Perfect.
Yes,
Thank
it's
you.
working.
So yes, for this presentation, my aim was to share with you the basic knowledge you need to have when you talk about physical activity with patients or with people who have pancreatic cancer and their relatives. And so for this, I thought that it could be nice to guide you through the very nice booklet about adapted physical activity, on which Esther, who is going to talk right after me, has worked a lot in order to provide this important information for healthcare professionals as well as patients. So here are my disclosures. So first, I think it's very important to share with the patients the right definition of terms. And the first two important message is that the best way to fight fatigue is not to rest and to limit the time where the patient is sitting or lying, because it will make the fatigue worse. And so I think it's the first point that is very important to share with the patient and the families during the consultation. And the second point is that physical activity is not sport, or is not only sport, because when we talk to patients and we tell them it's very important for you to do physical activity, some of them may be afraid that we are talking about sport. So with all that it implies in terms of competition, rules, all the rigidity of the way you practice sport. And so the important message is that physical activity is much more than sport. It's all the situations in the daily life where you are active, but not only during sporting activity, also where you are going from one point to another, walking or cycling, when you are doing gardening, when you are dancing. So the very important thing is to find activities where you have pleasure, because what we would like you to do is to do the physical activity over a long period of time and not just for 1 or 2 times during the disease. And the third important message is that this physical activity will be adapted to the treatment, to the symptoms related to the disease. And so, of course, we will not ask someone who is 40 years old and very sporty to do the same thing as someone who is 70 years old with other comorbidities. So I think these are the very important messages that we have to share in terms of introduction. Then the center of the action of physical activity is on the muscle, but we will see in the next slide that it's not just the muscle. There are also other effects of physical activity, but it's important to understand that during the cancer, there are some modification of the muscles due to the inflammation, due to the factors that are released by the tumor. And so we have muscle dysfunction related to pancreatic cancer. And so one way of physical activity to help in this disease is to limit muscle dysfunction by acting on the muscle fibers. And so why there is muscle dysfunction? It's related both to the tumor, but also to the treatment the patients are receiving, and particularly chemotherapy can play as well in the muscle waste that we observe in the patient. So it's something multifactorial, but physical activity will help on these different aspects. In terms of definition, there is also the importance of distinguishing malnutrition, sarcopenia, and cachexia, which are overlapping entities, but not completely synonymous. And so sarcopenia is the term that we use to describe the loss of muscle mass and muscle function related to the disease and the treatment. Initially, sarcopenia was something in the field of geriatric, and it has been translated into the field of oncology to talk about these muscle issues that we have during cancer. But patients who are malnourished are very often sarcopenic. And during pancreatic cancer, it's more than 2/3 of patients that are malnourished at diagnosis, and even more who suffer from sarcopenia. So I think these are also important definitions. And Esther will talk about the way we have to assess both the muscle composition, the muscle mass, the muscle function in patients in our daily practice, but that's the parameters that will be taken into account by physical activity professionals to adjust the program. Then, as I told you, physical activity has plenty of other benefits. The first one that is well demonstrated in the literature is its role to fight against fatigue, as I said before, because in patients with cancer, we have a vicious cycle between the decrease in physical activity, leading to a decrease in cardiorespiratory function and capacity of the organism to do exercise. And so the less we move, the more the fatigue increase, and we need to do physical activity to break this cycle. And we know that there is no pharmacologic intervention that is efficient against fatigue. The only way to reduce fatigue is by doing physical exercise. So I think it's also an important message for practice to share with your patients. And the idea is that physical activity, beyond its effect on the general condition and on the muscle, has also other benefits and different parameters, including metabolism, including immunity, including the microbiota. And so it's developing also beyond the field of supportive care as an integrated part of the treatment for patients in order to increase the efficacy of other treatment. Another important point is that you can't talk about physical activity without talking about nutrition and vice versa. It's very important to always put both of them together, because in order to have the best effect on the patient malnutrition or sarcopenia, you need to combine physical activity with nutrition. So for nutrition, we know that we have different tools. We have dietetic counseling, we have oral nutritional support, artificial nutritional support. It's important to define the calorie and the protein goal and to make sure that the patient covers his needs with the food intake of a nutrition intervention. It's important also to take into consideration that doing physical activity will induce an increase in the energy needs. And so the patient will need to have more protein, more calories. And so it should not be combined with exclusion regimen, with fasting, for example, because it will be a risk for the patient to increase the malnutrition. I remind you that during cancer treatment, there is no evidence at all that practices such as exclusion of glucose or fasting can bring a positive effect in patients. So it's not recommended to do that. It can increase malnutrition and toxicity of treatment. So then, that said, how do we put that in practice? What it is in the reality, how we advise patients to do physical activity. It's important to know that physical activity for each patient is defined based on some parameters called the FIT-VP. So for frequency, intensity, time, progression, volume, and type of exercise. So when we want to describe the physical activity we want the patient to have, we need to take a time on each of these parameters. So first, the important thing, Esther will develop that further, is that we combine two types of activity. Aerobic activities, in order to improve the cardiorespiratory fitness and so to decrease the fatigue linked to the deconditioning cycle that I described before, and also strengthening exercise in order to improve the muscle mass and function. And then we have to adjust for each patient the type of exercise, the intensity of the exercise, and the progression. For every patient, the important is that we start low and we try to get to the the right level of intensity in terms of exercise. An important thing also to have in mind is how a patient can know about the intensity of the exercise is doing. And for that, there are easy parameters regarding breathing and talking. When you can do the exercise, but you need to breathe more heavily, but you are still able to talk, the intensity of the exercise is moderate. It's the minimal intensity if you want to improve the cardiorespiratory fitness. But if you do an exercise where you are short of breath and you can't talk anymore, it's vigorous intensity. It's something that is more efficient to improve the physical condition, but it is also associated with potential risk. So you should be monitored by a professional when you go into this intensity of exercise. Then we have also in the booklet the counsel about the professional that you should meet before starting the physical activity. So regarding the medical evaluation, the important point is that healthcare professional should rule out a risk for a potential cardiac event in a patient. So if we have a patient who is at high cardiovascular risk, it's needed to have a consultation with a cardiologist to have a green light before starting a physical activity program. And then there is the question of being accompanied for this practice by physical activity specialists. Unfortunately, these specialists are not available in all countries. But the idea is that these professionals have a specific formation, a specific training in order to assess patients with medical issues and to design personalized program for these patients. But for example, in France, they do exist, but they are not reimbursed by the national health system. So it's also an issue about the availability, the accessibility of these professionals. One of the other important message is about involving the caregivers and the family and the friends in this practice of physical activity, because I said to be efficient, the patient needs to be regular in the practice and to do it all over the course of the disease. And so we need to have motivation. And when you involve people you like and you practice with them, it's a very good way to stay motivated and also to give another dimension to physical activity. It's not just doing exercise for the performance, for doing exercise. It's also because it's a social experience. It's something that brings you pleasure, not only by the physical experience, but also by the setting where you do that. And so it's something very important to put that into another context, another dimension of sharing good moments with friends. It should be something for the quality of life first. And so finally, the important message that we have in the booklet is to have this information and discussion with the the healthcare professional for all patients about the benefit of physical activity, reassuring the patient and the family about the safety of doing physical activity. There is no risk. We have plenty of trials showing that there is no risk. So as we said, we have to be careful in patients at high cardiovascular risk, but otherwise it's something that is progressive, that is with an adapted intensity, so it's safe. It's important to reduce the time where we are not active and to keep on being as much active as possible during the disease and between the different chemotherapy treatments. It's important to have this progressivity into practice. You will not decide to go from 0 to running a marathon from the first months of starting physical activity. So that's why there is this idea of adapting clearly the volume and the intensity according to the previous condition, the symptoms, the treatment, etc. having this idea of being regular in the practice, the motivation, and so not making this like something you need to do as a work, but you need to do that for pleasure and to feel better both in your mind and in your body, and be supported by the family. But also I think that as healthcare professional, we have also a very important role in helping patients in their motivation to practice this by showing them the benefits they can derive from physical activity. So with that, I think I shared with you the basics, let's say, for this physical activity and why patients should do physical activity. And in the next minutes, Esther will show you how we do that in practice.